We do have a remarkable panel today. We're going to start out with Martine Rothblatt, who is a lawyer and author, and she's a CEO of United Therapeutics and also Lung Biotechnologies, which we'll talk a little bit more about when we get into the question and answer. So thank you, Martine. And then we have John Horgan. John has been a science journalist, and he's also an author. He has written for many different journals, including the National Geographic, New York Times, but most specifically, he wrote for Scientific American, and he continues to have a fascinating blog on the Scientific American website. So thank you, John. And then our third panelist will be Greg Kabnick. And Greg is the author of Humans and Nature, The World as We Find It, and The World as We Create It. And Greg is a scholar, a researcher at the Hastings Center, which I'm actually going to say just a bit about right here. I think the president of the Hastings Center, Millie Solomon, will appreciate our bringing this to all your attention. The Hastings Center was the first ever think tank addressing biotechnical issues, bioethical issues. In fact, the founder of the Hastings Center sometimes is considered the father of bioethics, Dan Callahan. And it has been focusing for decades now on issues in medical ethics, in research ethics, and in biotechnologies. And more recently, it has expanded its focus to include artificial intelligence and robotics with a project called Control and Responsible Innovation in the Development of Autonomous Machines. And interestingly for this crowd is there are 3 finalists for this year's World Technology Awards who are the co-chairs of that last project. That includes Stuart Russell, Gary Marchant, and myself. So that's enough about the Hastings Center, but I think for those of you interested in issues in bioethics, you really might want to take a look at the Hastings Center website. This panel is titled after my book, but it's not going to be specifically about the book. These are 3 of the brightest people I know, and I think we want to talk with them as much about ideas, interests that they have initiated. But I will take a few opening minutes just to tell you about the book and perhaps bring it up through the conversation as a way of just setting the stage for the broader conversation or questions we're going to talk about here. So I began writing this book, which originally had many different names, but it finally finished up with the name of A Dangerous Master. And I started writing it largely because I thought there was a need for a primer on emerging technologies. Even the scientists who were creating some of these new sciences couldn't necessarily give you a definition of another one. So a neuroscientist might know next to nothing about nanotechnology and couldn't define what geoengineering was. And I saw that the same problem was happening for scientifically literate citizens who were fascinated by the subjects, wanted to jump into the countless debates that were arising, but didn't feel they had the competence to do so. So my idea was how in basically 100,000 words or less, I could make sure that people had the basic information, or at least the basic information I thought they would need in order to jump into the conversation. So that was the driving force behind the book. There's a little bit of science, there's a little bit of history, there's quite a bit about the benefits of emerging technologies. But my role in this ecology of thinkers, scientists, around the new sciences has been largely about what can go wrong or what might be disruptive societal impacts. So that's where I place the emphasis in the book. It can sometimes be a little daunting when you start to realize just how many different things need some degree of oversight or need our attention. But I try to sort out which are really the serious ones and which have been overhyped. And then the last 5 chapters of the book looks most specifically at how we can respond to these risks and societal impacts through ethics and engineering, and through oversight, and in some cases, new forms of governance. So that's the basics about the book. The title came from a quote from a 1920s Norwegian peace activist, Christian Los Lange. And Christian Los Lange said, "Technology is a good servant, but a dangerous master." And I've juxtaposed this with a quote from Professor Irwin Corey, who said, if we don't change direction soon, we're going to end up where we're headed. So the basic idea here is that in some areas we need to at least alter the trajectory a little bit. And to what extent can we do that in scientific development? Alter the trajectory if we want to ensure that scientific development stays a good servant and does not turn into a dangerous master. So rather than say more about this at this point, I might bring up a few elements of it as we move along. I think maybe we can go into a little bit of question and answer here with our three panelists. So I'm just going to join you down there. So this is a little bit more a conversation than a grilling. But I will start with a few questions for each of our panelists. And I want to start with Martine. So Martine, you have been busy over the last few decades inventing the future for us. And you started with a series of different companies that you founded. Probably most distinctly in many people's mind will be GeoStar and Sirius Radio. And then you turned to biotechnologies. And with the founding of United Therapeutics and Lung Biotechnologies. And one of the interesting things about those companies is the amount of groundbreaking research that you are engaged in, research looking at everything from the creation of artificial lungs to RNA interference to whether we can rehabilitate lungs that have been donated so that a much higher percentage of them have the quality where they could actually be transplanted into people who are in dire need of these organs. So I thought perhaps you could start out just by telling us a little bit about why you founded these companies, what personally precipitated that, and why you're putting so much energy into these new technologies.
Sure. Well, thank you, Wendell. I'm very glad to be here with my fellow panelists. I just mentioned to the gentleman to my right that my three subscriptions I read most often are the New York Times, National Geographic, and Scientific American, which are his three publications. So, well, it's a very generous introduction, Wendell. I can't truly claim that I've been inventing the future for anyone. I think that I've just been lucky to be part of a team that consists of hundreds and even thousands of people throughout the United States and overseas who are always working on either new aerospace technologies in the case of my work in satellite communications, or new biotechnologies in the case of my more recent work. And even the companies that I've founded, it's never just been like I as me. It's always like a group of a lot of people. And it's relevant, I think, Wendell, to your question and to the context of this entire panel, that I do believe that these technologies are not the sort of thing like an individual in the desert finds a genie bottle and an individual takes the initiative to uncork the bottle and bring this dangerous master or genie, into existence. Instead, the better analogy, I think, is that there are, all total, literally millions of human beings working on all different types of bottles for all different types of genies, each putting in there stone by stone and painting it. And all of our technology is a collective work of everybody alive today, and to a very large extent, all of our immediate and even more distant ancestors. In my case in particular, when I was at that very impressionable age of adolescence, preteen, around there, my dad thought it was very cool to get me out of bed in the morning or let me stay up late at night and watch the rocket launches during the Gemini and especially the Apollo program. So I got imprinted like a baby duckling following a newborn mother duck with like space technology, space technology. And as I got older, I wanted very much to be part of these, millions and millions of people helping to move humanity off what Carl Sagan so eloquently referred to as a mote of dust in a beam of light, our planet, and help move us off into the cosmos. And one practical way that I thought I could do that would be by throwing out the first planks of wood and canoes and rafts, which are satellites in various orbits up to including the geostationary orbit. So that love of space technology, imprinted with the admiration for astronauts previously, explained my initiative in creating these satellite communications companies. And while I was at SiriusXM, our youngest daughter, Genesis, was diagnosed with a rare so-called orphan disease that at that time was universally fatal. And she was given just a few years to live. And I just my love for my daughter gave me no choice to do whatever I possibly could do to save her. So I gave up my position at SiriusXM, spent all of my time re-educating myself about biotechnology. And as a result of that, we now have 5 medicines approved by the FDA. Best of all, my daughter Genesis is 31 and works in our company. And thousands, tens of thousands of other people are taking our medicines and living better lives. So that's the background there.
Do you want to say one or two words about why you've jumped now to these lung technologies?
Yes, because our medicines, they're not a cure for the condition that afflicts my daughter and many thousands of others. The condition is called pulmonary hypertension. It's the arteries between your right side of your heart and your lungs. They just clamp down. They don't let blood flow through those arteries, so the blood can't get fresh oxygen, and ultimately the patient dies as a consequence of that. But what we're able to do is we're kind of like able to force them open the way you might have a lift your car up with a jackhammer or something to leverage it up. So we force the arteries open. But the disease is kind of inexorable, and ultimately it overcomes the effect of this medicine and other variants of the medicine over a period of years. However, since the first lung transplants in the late 1970s, it was observed that not one single pulmonary hypertension patient who ever had a lung transplant ever redeveloped pulmonary hypertension. And by the way, that's also true for a number of other fatal lung diseases like idiopathic pulmonary fibrosis, and for that matter, even COPD, emphysema. So a lung transplant is positively, definitely a cure for these end-stage lung diseases. However, transplantation basically brings along with itself what you might call an iatrogenic disease or a medically induced disease, which is chronic rejection of the transplant. Also, there are only a small number of lungs which are able to be salvaged from people based on the way they die. So the number of lungs available is never anywhere near enough for the number of people with end-stage organ disease, and just a small fraction of the people with end-stage organ disease are actually able to avail themselves of a lung transplant. So I began to think that, it might be possible using the advent of new technologies such as nuclear cloning and being able to make many animals look the same as a precursor animal, gene editing using the consequence of the initial genome sequencing that one of our speakers, I believe this afternoon, Craig Venter and Francis Collins, pioneered at the end of the 1990s. That technology has advanced so much that it cost $1 billion to sequence Craig Venter's genome, but it now is costs $1,000 and sinking very fast to sequence other people's genome. That it might be able to use these techniques to, instead of making sort of like a tomato that stays ripe or an apple that doesn't brown when you cut it, maybe we can use these techniques on a mammal, in particular a pig, whose organs by fluke of nature are a very good match for human organs, and edit the antigens on the surface of the pig organs by editing the appropriate parts of the pig genome, so that the pig will produce organs that could be transplanted into people and allow them to either have a healthy life without rejection because of the ability to plan the transplant in advance and thereby somewhat chimerize, or if you will, mix the recipient's immune system with that of the pig donor to them so that they won't reject the organs chronically. Or in the worst case, if they do reject them, you would have an unlimited supply of retransplantable organs. And so it's, again, a quest to save the lives of our patients even longer that has propelled me into this area of manufactured organs.
We'll come back to that in a second round of questions. I want to raise something with John first. So, John, you've been not only one of our most respected scientific journalists, but a controversial one who has raised new ideas. And you're best known for your bestseller, The End of Science, which has just been reissued again by Basic Books in the last few months.
Mm-hmm. Thanks for mentioning that.
And in The End of Science, you talk about complexity, which is also a subject that comes up in a Dangerous Master, as a little understood topic, really. And it's something that you argued was putting a ceiling on our ability to make breakthroughs in many of the areas of science that are the next realm, or at least not the next, that this is putting a threshold on scientific discovery, or at least real difficulties in what can be answered. And the interesting thing is that's coming at the same time as so many people, including people here today, and Martine in her previous comments have talked about exponential growth. Mm-hmm. Exponential growth both in terms of Moore's law, but also in terms of how quickly we're seeing the cost of the genome going down. So I wonder how you reconcile that perception that technology or technological innovation is speeding up at the same time as you perceive that scientific discovery, at least in some dimensions, is slowing down.
Yeah, well, I should say that I became a science writer more than 30 years ago because I love science. I thought science is the most important part of our culture. It's one place where we are really making progress. Every day we learn a little bit more about how the world works. There are new inventions, and I wanted to celebrate that as a journalist. And over the course of my career, I began to worry that by focusing on all the kinds of amazing advances that you've been involved in, for example, and that some of the previous speakers have already talked about, CRISPR and so forth, and of course the astonishing growth in information technologies, that people are getting a distorted view of what science is really capable of. So I, in my career, have become kind of the skunk at the party of science and have really focused on the limits. So let me just give you a couple of examples. One is neuroscience. So one of the oldest questions is how does a brain make a mind? It started out as a profound philosophical question. It's become a scientific question. Neuroscience is maybe the fastest moving field in science. They still don't have a clue how a brain makes a mind. I was just at a conference at NYU a week ago where serious scientists and philosophers were debating whether panpsychism is the correct way to think about consciousness. That would mean that this is conscious. For example, on the table, everything is conscious according to panpsychism. Looking at a more practical dimension of the mind-body problem, psychiatry is still in a very primitive state. Our treatments for mental illness are not effective at all. Shock therapy, electroconvulsive therapy, is coming back as as a treatment for severe depression, which I think is an indication of the weakness of the medications that we have. Just one more example that's relevant to some things that have been presented and will be presented at this conference. Genetics, of course, astonishing progress in genetics. The cost of sequencing has come down. We've had the Human Genome Project, which Craig Venter, who will speak here this afternoon, has been involved in. And yet, the last time I checked, there was not a single genetic therapy that had been approved by the FDA in this country. Also, another problem that I think should be discussed at a meeting like this that celebrates innovation and advances in technology is the ridiculously high cost of healthcare in this country, which has been linked in many cases to innovation and technology, which in the example of cancer has led to over-testing and over-treatment. This is an emerging consensus among people who are tracking cancer research. So again, sometimes I get tired of being the person who has to point out all these areas where we are not making progress, but I think it's important to give people a realistic sense of what science is actually capable of right now.
Great. Thanks. And maybe a word or two about if you think that science is slowing down in that way, the fact that we seem to be having so much progress on the technological front?
Yeah, so what's fascinating to me is how the advances in information technology have led to this enormous enthusiasm for what might happen in the future, including the possibility of the singularity, which is a very dramatic transformation of our humanity, possible immortality, exponentially greater intelligence than we have now. And actually, I'd be very curious to know, because I know you're interested in transhumanism, whether these things will happen, whether IT is enough to make it happen, or whether we actually have to have an understanding of how our brains work before something like the singularity would be possible. Right now, I don't think it is possible. I'm a pessimist when it comes to the singularity and some of the more dramatic versions of transhumanism.
Well, maybe we'll get back to that if we have enough time with our session here. But let me turn to Greg here for a moment. So, Greg, I think it's fair to say that you have been involved in reflecting upon the benefits and risks of synthetic biology, which for those of you who don't know that term, it usually refers to the creation of new biological products or organisms through various technological means, but most centrally genomic means. And you have been doing this now for years, looking at really every aspect of this, and largely through convening workshop after workshop after workshop with leading figures, and going into depth in the discussions with them, and then producing some reports and some books around what your discoveries have been. And I wonder, after all of this, if you might be able to give us a general assessment of whether you see the benefits of synthetic biology far outweighing the risks, and whether there might be one or two of the risks that seem, if not risks, societal impacts that seem of particular concern for you.
Sure. So I think it was just this morning, I saw a new definition of synthetic biology in a story in the New York Times. The definition was just sophisticated genetic engineering. And I think that that's actually a fairly accurate account. The goal for synthetic biology was to achieve genetic engineering in a way that seemed to synthetic biologists like Craig Venter and Drew Endy and Jay Kiesling at Berkeley to be only metaphorical with the original set of technologies. Their idea was that you could come up with cellular platforms. I should say there's nothing in the definition of synthetic biology that limits it to one set of organisms or another, but in practice, it's mostly aimed at things you can do with microbes, and mostly aimed at turning microbes into effective tools or machines, factories for making new things. And there are various lines going into this. Craig Venter has been working on developing a sort of cellular platform that you could modify. Drew Endy and others who are part of the BioBricks movement have been working on developing little bricks, BioBricks, little tools that you can put together in modular systems and then insert into the platforms to turn them into the tools or factories that you want. And then Jay Kiesling and others are really doing what amounts to sophisticated genetic engineering. There are all sorts of applications in industrial applications, ways of producing chemicals using biological factories instead of petrochemical factories, modifying cyanobacteria, for example, so that it will make ethanol. There are medical applications, there are agricultural applications, and as the array of technologies for genetic engineering is developing, it's moving beyond microbes into complex organisms. One of the there was a question put to Jennifer Doudna. What do you think is the most out there application for the CRISPR technology that you foresee? One of the things that I'm working on right now is the implications of what are known as gene drive technologies. The gene drive is really a sort of just a general concept for a genetic element that would be preferentially inherited, that would not adhere to the Mendelian rules of inheritance, but would ensure that a gene of interest, if it's an artificial drive that you've created, would be forced from the parent into the progeny, and eventually across, if you wished, an entire population. And so you can begin to talk about modifying complex organisms, and in fact, you can begin to talk about modifying entire populations, in principle, entire species existing in the wild, and then by modifying those species, you can modify the ecosystems of which they're a part. So, it's all to say, I am fairly excited about some of the microbial applications of synthetic biology. I do not personally, there are certainly concerns about the risks. I'm fairly optimistic about them. But it's very early days with some of these newer applications like gene drive.
Well, I have been warned that we have much less time than I thought, which is going to make it difficult if we get as in depth to get even through this second round of questions. But so I'm going to try and, make the questions a little tighter than I had originally planned and ask for maybe some quick responses. But Martine, you've been championing all kinds of technologies that are controversial in different ways, from xenotransplants to digital uploads, which is the topic of mind uploads, which is the topic of your latest book. And I think all of these books are fascinating because Martine really does try and address all the different critiques and at least come up with what she thinks are adequate responses to those critiques. But I'm just wondering if, as you look at the breadth of emerging technologies, is there any one that gives you cause for particular concern? And would you, and for that one at least, would you suggest increasing oversight or perhaps even the banning of that technology?
So I'll try to make this brief, Wendell. I'm not an expert on all the different technologies
Sure.
out there, so and it's my nature to work on ones that I think are basically overwhelmingly positive with a de minimis risk of harm. Somebody working probably on the original domestication of fire would be far riskier than me because untold damage has occurred through fire, untold benefit as well. But the technologies that we're developing are ones that I think are very well managed by the Asilomar regulatory guideline, which basically says that you take a look at the risk of harm of a technology and you provide a containment level appropriate to that risk of harm. And as things that are very, very dangerous, for example, a remnant of smallpox is something that, rather than completely eliminating from the face of the earth and never knowing what it looked like in case it could ever be of value, that was the most horrific disease ever visited upon humanity. Instead, you keep it in the strictest possible containment situation that humanity can develop. Nuclear energy, falls under this vast regulatory regime. And I think the consensus of most people is that the general concept of harms, the containment required for a harm varies directly with its potential for harm. And I think like the Iran negotiation is a good example of how the world has come together over that.
Wonderful. Great. John, your latest book is The End of War. And I think you argue very effectively in that book that perhaps humanity is starting to understand, or hopefully understanding, that most of the arguments for war are pretty spurious in terms of whether they'll produce the results they portend to. And I wonder whether when you look at the emerging technologies, whether you see that any of them will exacerbate this movement toward ending war, or, well, what should I say, will exacerbate the damages of war, or perhaps one of them might speed up this movement toward the ending of war.
So I wrote The End of War because I started doing surveys kind of spontaneously about 12 years ago of people's attitudes toward war, and found out that the vast majority of people, I'm sure probably 90% of the people in this room, think that war is a permanent part of the human condition, and I tried to present arguments for why we shouldn't have this extremely pessimistic belief. War is not innate. It does not go back hundreds of thousands or millions of years back to our common ancestor with chimpanzees. This is a hard argument to make right now. I realize this is a scary period in human history, which is precisely why I wanted to make it. Obviously, there are many things to worry about and that are perpetuating war, and one, I think, is what I would call the militarization of American research, which has led, for example, to drones, which the U.S. has demonstrated are extremely versatile weapons, but this has now led to what I would call an international arms race in drones. There are 70 other countries now that are pursuing their own development of drones. The new BRAIN initiative announced by Barack Obama a couple of years ago, more than half of the funding for that comes from the Pentagon. That concerns me. The Pentagon is interested in developing what might be called neural weapons or neural enhancements for their soldiers. And I feel as though there should be a really vigorous debate, at the very least, of this trend in research, and there isn't right now. So I'm trying to call attention to that as well in my journalism.
Great, thanks. So Greg, at the end of your response to the introductory questions, you said a little bit about gene drives. And Martine has alluded to the Asilomar Conference, which very early on set the ground rules for genomic research. And we have a number of representatives in this room of people who've really been religiously following those ground rules. But now, the advent of CRISPR and the likelihood that that and other technologies might speed up the development of, in particular, gene drives or perhaps some of modifications to the human genome has brought up all these calls over the past year for increased standards. And you are sitting on a National Academies Committee which hopes to come up with some recommendations in that regard. So I wonder if you could just say a little bit more about that, and maybe particularly use the example of one of the case studies you worked on, which is swarming locusts.
Well, okay, so the swarming locust example is something that so far as I know, is mentioned only briefly, only glancingly in any of the scientific literature. But in talking to one of the developers of gene drive technology at Harvard, scientist Kevin Esvelt, he shared with me his ambition to work on this. His goal is that it turns out that the desert locust, the insect of biblical plague fame in North Africa and the Middle East, passes through two phases, depending on triggers. There's a solitarious phase in which it's green and hops around and stays away from others of its kind and is very picky, I think, about what it eats. But then when the rains come and the population builds up to a certain density level, something in the desert locust is triggered to turn into a new phase, a gregarious phase. And at this point, it changes color. It becomes red and black. It flies differently. It changes shape. It begins to swarm and it takes to the air and is blown, across country boundaries. And it will eat anything in sight, famously. The damage to an entire nation from a swarm of locusts turns out not to be severe, typically, but the local damage can be absolutely catastrophic, with probably very severe knock-on socioeconomic effects from this complete devastation that can be visited in the course of a growing season. So Kevin's idea is that it would be relatively easy to figure out what the genetic switch is, because you could find out, you could knock out different genes and then raise them in the population density that should normally trigger the switch to gregariousness in the red-black phase. And if that doesn't happen, then it looks like you might have got it. And so that would be the strategy for finding it. And then you could incorporate that. Well, you could build a genetic drive, a gene drive around that insight. So you'd go through and you'd probably it's just a knockout situation rather than introducing some new genetic element. And you release some individuals that have got this drive and will force the genetic change you want, the knockout, through the population. And assuming you've designed the gene correctly, and there are problems with off-target effects and making sure that the cutting actually works just right and so forth. But if you've got it so that it's evolutionarily stable, and Kevin and others are at work on some strategies for this, then you might be able to completely change this, historically significant, possibly ecologically significant species. And so you have this moment where we can, as Kevin points out, you can make a kind of change to the shared environment that has never really been contemplated before. One of the things that's really interesting about this moment in genetic science is that there are so many who are having this kind of a Silmar moment and really want to make sure that there is this very careful social international discussion of the implications of these technologies, and Kevin is one of these individuals.
Well, I know that one of the concerns about gene drives is that swarming locusts affect more than 40 different countries, from what I understand. And so the question there is really how many ecologies are being changed.
Right.
And this looks like a situation where the benefits overwhelm any risks to the ecologies, but we don't really know that. And we certainly don't know that from many other species that gene drives could be created. But unfortunately, I have a sign that says we're going to need to end this session. So let me end with two notes here. One is just to thank the panelists for coming. This has been a wonderful panel. And I think that even those of us who are trying to underscore the downside It is not because we want to be turning away from the sciences as much as we just want more vigilance taken in terms of looking at whether there are creative ways of responding to what could go wrong. And I think that holds true as much for Stuart Russell and the work he's doing around questions about demonstrating that AI will be absolutely beneficial as it is for questions around gene drives, for example. So thank you all, and thank you.